Hello and welcome to the Osteoarthritis Action Alliance Lunch and Learn webinar for March 18th, 2026. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors who help support our work, which includes the Lunch and Learn webinar series. Now it is my pleasure to introduce today's speakers, Sarah Levine and David Shapiro. Sarah coordinates and manages research and outreach projects and initiatives across the Centers for Health, Work, and Environment, which is based at the Colorado School of Public Health. In this role, Sarah collaborates with interdisciplinary teams to advance the center's mission. She specializes in research project management and in increasing the reach, implementation, and impact of total worker health programs across diverse organizations. Sarah's areas of expertise include workplace chronic disease prevention and management, recovery-friendly workplace practices, and evidence-based strategies that integrate health, safety, and well-being. David Shapiro is Assistant Director of Programs and Partnerships at the Centers for Health, Work, and Environment. In this role, he oversees the center's signature employer-facing programs, HealthLinks and the Colorado Recovery Friendly Workplace Initiative, supporting organizations to implement the total worker health approach through strategic consulting that promotes mental health, safety, and well-being. David advises over 250 employers annually, primarily in high-risk industries and underserved communities, and develops workplace trainings on recovery, mental health, chronic disease, and family-friendly workplace practices. He also serves on national advisory groups focused on workplace-supported recovery and chronic disease prevention. David holds a certificate in total worker health. He is completing his MPH in leadership and public health practice at the Colorado School of Public Health, where his research explores how organizational factors impact employee outcomes for people in recovery. The title of today's presentation is Why Employers Matter: Expanding Coverage for Evidence-Based Chronic Disease Prevention and Management. Welcome, Sarah and David.
Good morning, everyone, or afternoon, depending on where you are. I'm just gonna start, David, if you want to advance the screen. Thank you for joining us today, and thank you to the current Osteoarthritis Action Alliance sponsors shown here who help support our work, which includes the monthly Lunch and Learn series. And then I will thank you. Okay. Good morning or afternoon, depending on where you are. My name is Sarah Levine, and I am joined by my colleague David Shapiro. Today, we will be presenting findings from our work on employer engagement strategies to promote evidence-based chronic disease prevention and management programs. And we'll specifically be talking about the National Diabetes Prevention Program. So I want to start by kind of setting the stage and talking about our program called HealthLinks. So HealthLinks is an employer-facing program based at the Centers for Health, Work, and Environment at the Colorado School of Public Health. We are part of the University of Colorado Anschutz. And our goal is to help organizations create healthier and safer workplaces. We support employers in improving worker health, safety, and well-being by using data-driven and evidence-based strategies that work in real-world settings. Through HealthLinks, organizations receive assessment tools, goal-setting support, technical assistance, and practical resources to help them implement effective workplace policies, practices, and programs. We work with organizations of all sizes and across many industries and sectors, helping them build sustainable approaches to workplace health, safety, and well-being. HealthThinks focuses on five core areas. So, leadership and organizational support. So, really, we work directly with employers on the organizational level. Health and safety policies and programs, employee engagement. So, what does the employee engagement landscape look like in an organization? Are employees utilizing the programs? Are they being communicated with in an effective and equitable way? Data and evaluation, and worksite environments and culture. This work includes many aspects, including chronic disease prevention and management, which is what we'll be talking about today. And All of it is grounded in the National Institute for Occupational Safety and Health, or NIOSH's Total Worker Health Framework, which integrates safety with overall worker health and well-being. So as mentioned, today we will be talking about a paper that we submitted for publication in 2023 as part of occupational health science called Employer Engagement Strategies to Promote and Add Evidence-Based Chronic Disease Prevention and Management Programs as a Covered Benefit. So a mouthful title, but essentially, chronic disease has become one of the most significant challenges affecting the workforce today. While evidence-based programs do exist to prevent and manage chronic conditions, they are often underutilized in workplace settings. This paper and our research explored how employers can be more effectively engaged to support and implement these programs as covered benefits for employees. So that would mean integrating the benefit into a benefits package and having coverage for employees. Our research aimed to better understand how employers can be effectively engaged to support chronic disease prevention programs. Specifically, we wanted to explore strategies that could increase employer awareness of these programs, encourage organizations to cover them as a health benefit, and support promotion to at-risk employees. And ultimately, the goal was to identify practical strategies that help organizations move from awareness to actual program adoption and implementation. So, why does chronic disease matter at work? Chronic disease is a common condition and has major workforce implications. Just some statistics: about 6 in 10 US adults have at least one chronic condition, with diabetes and prediabetes affecting roughly 130 million Americans, many of whom are working age. The economic impact is significant. So, diabetes alone costs over $300 billion annually. And that includes both medical expenses and lost productivity. For employers, this means higher healthcare costs, absenteeism, reduced productivity, and disability-related expenses. Because adults spend much of their lives at work, the workplace is a critical setting for prevention and intervention, especially for high-risk populations who may lack access to care outside of work and really depend on the workplace infrastructure in order to support those needs. Work conditions can increase risk. So risk factors are linked to work that can increase the risk of developing diabetes is shift work, long hours, sedentary work, work stress. And these have a huge impact on employers, as mentioned, higher health care costs, missed work days, reduced productivity, and complications affecting employee well-being. Despite strong evidence, many employers do not yet offer or promote these programs as a covered benefit, even though they do exist, and this leaves room for impactful workplace health initiatives. So why are these programs underutilized in workplaces? There are several barriers that we found. On the employer side, organizations often lack awareness of available programs. So the program might be available in their health plan, but they're just not aware or have a lack of understanding of the availability or how they work. Understanding of the business case and internal resources to implement them. There are also employee level barriers, including concerns about time commitment, awareness of programs, and convenience. Because of these challenges, even though effective programs exist, many employees who could benefit from them have never had the opportunity to participate through their workplace or take advantage of those benefits that are included. So now to get into kind of the details of our study and the specific intervention. So this work was conducted through HealthLinks, which is a total worker health program, which, as I mentioned, was developed at the Centers for Health Work and Environment. Um, Through this work, we engaged 349 organizations across Colorado to explore strategies for promoting chronic disease prevention programs within workplaces. And this existing infrastructure allowed us to test different approaches to employer engagement. This is a logic model that we developed in order to guide our evaluation and support dissemination and implementation of these evidence-based chronic disease prevention and management programs in workplace settings. I'll get to our specific methods and engagement strategies in the next few slides. But essentially, this model outlines strategies to engage employers through education, evidence-based resources, and technical assistance, supported by local public health organizations. And this model was really helpful in for us to kind of like identify the problem and kind of look at the different mechanisms, mediators, the process outcomes, short-term outcomes, and long-term outcomes. So now to get into the methods, our intervention focused on three main employer engagement strategies: education and training, evidence-based resources, and advising. And I'll go through these one by one. So the first engagement strategy was education and training. These included webinars that we hosted through HealthLinks and other things. These included webinars, live events, and presentations by subject matter experts. The main goal was to increase awareness about chronic disease in the workforce and demonstrate the business case for implementing prevention programs. These sessions targeted individuals responsible for workplace health initiatives, so that would include HR, benefits, safety, wellness professionals, really those in organizations who have decision-making power. The next engagement strategy was providing evidence-based resources and tools to employers. One of these tools was the Healthy Workplace Assessment, which is kind of our signature assessment, which helps organizations evaluate their policies and practices related to employee health and safety. We also utilized and disseminated an employee risk test, which helps organizations understand how many employees may be at risk for developing prediabetes and in turn type 2 diabetes. The risk test that we developed was based on the CDC risk test as well as the American Diabetes Association risk test. Providing this data helped organizations better understand their workforce health risks and gave them information to support decision making and program planning. Thirdly, the third strategy we used was direct advising and technical assistance. So through these advising sessions, we worked with employers to interpret assessment results, review their benefits plans, identify barriers to implementation, and develop action plans. We also, as I mentioned, helped organizations review their health insurance plans, evaluate program options based on the needs of their specific workforce, and develop communication strategies to promote programs to employees. This personalized support helped employers move from just simply learning about the program to actually planning and implementing them within their organizations. So now to get into some of the key outcomes, it looks like this table accidentally got a little cut off. But we reached 349 organizations representing over 160,000 employees with the goal of increasing employer awareness, supporting program adoption, and engaging employees in prevention. We hosted 9 education and training events, conducted 51 advising sessions, and through the Healthy Workplace Assessments, 349 organizations participated, and we identified 83 that were assigned a specific goal for chronic disease prevention as part of their overall action plan. So what we learned from this work in terms of barriers and facilitators, common employer barriers included limited awareness of program benefits, lack of knowledge or skills to implement programs, and limited resources or staff capacity. Employee level barriers included time commitment and participation challenges. We also found that smaller organizations often struggled with lower perceived risk and fewer supportive policies, which in turn made implementation more challenging. At the same time, several factors helped facilitate implementation. Education and training increased awareness, data helped build the business case, and advising provided hands-on support. Overall, we found that organizations that used multiple engagement strategies together were more likely to move forward with adoption. One of the key things that we wanted to understand through this work was what successful organizations had in common when moving from awareness to implementation. Across organizations that did adopt or made progress toward implementation, there were several characteristics that stood out. Successful organizations had strong leadership support, collaboration across departments such as HR, wellness, and benefits, and relied on data-driven decision making. Tools like the Healthy Workplace Assessment and Employee Risk Test helped organizations understand workforce risk and build the business case for prevention. And programs were also more likely to be adopted when they aligned with the broader organizational goals around employee well-being. Based on these insights, we developed several recommendations for engaging employers. First, education and training are essential for building awareness and trust. Direct outreach and employer decision makers, paired with clear and consistent messaging about the impact of chronic disease, helped initiate engagement. Second, providing evidence based resources such as the employee risk test helped organizations better understand their overall employee risk. Developing this tool, or delivering this tool in person, such as during workplace health fairs or events, was particularly effective in increasing participation and generating data to support the business case for the NDPP. Finally, advising and technical assistance helped organizations translate awareness into action. Through advising, we used the Healthy Workplace Assessment and helped employers review their medical benefits to identify opportunities to cover programs like the National DPP. Overall, our findings suggest that combining education, data-driven resources, and personalized advising can help organizations move from awareness to successful adoption of evidence-based programs. Through this work, we identified several key lessons about engaging employers in chronic disease prevention programs. First, employer engagement is essential. Simply making programs available is not enough. Organizations need to be actively engaged and supported throughout the process. Second, data plays an important role in building the business case. Tools like the employee risk test and healthy workplace assessment helped employers better understand the level of risk within their workforce and the potential value of prevention programs. Third, successful implementation often requires organizational champions, which are individuals within the organization who are committed to advancing workplace health initiatives and moving programs forward. And I'll just reiterate, we also found that using multiple engagement strategies together, and these high touch engagement strategies such as education, resources, and advising was more effective than relying on a single approach. Finally, support needs to extend beyond additional adoption. Ongoing promotion, communication, and organizational support are critical to ensuring long-term sustainability and participation of these programs. And yeah, thank you for listening. If you want to get in touch with us, I've included my contact information below as well as our website, and we'll be sharing some follow-up resources in the follow-up email as well.
Great. Thank you so much for that presentation, Sarah. It seems like, a lot of what you learned from your work in the diabetes space could apply to other chronic conditions as well, like arthritis. Um, I welcome anyone in the audience to type any questions that you might have into the chat, and I will read them aloud. While we're waiting for some questions to come in, I'm curious, Sarah, just based on your findings, what would you say one or two key things are that employers can do to better support chronic disease prevention in their workplace?
Yeah, thank you for that question. I think one thing that we consistently, are trying to advance either through our direct communication with employers or through our newsletters, our webinars, is to actively connect employees to evidence-based prevention and management programs, whether that's through like their accessibility through benefits or education and training opportunities or workplace wellness initiatives or community partnerships. So really, building that awareness and education and having that like point of connection for employers to actually like take action. Um, that's what I would say. David, I don't know if you want to chime in at all.
Yeah, thanks, Sarah. Thanks, Katie, for the question. Hi, everyone. David Shapiro, he, him pronouns. I also work at the Colorado School of Public Health. Thanks for having us here today. One recommendation we usually make right at the beginning with employers is Try to better understand the risk profile of your employees, at least at an aggregate level. It's really a lot better and easier to have conversations with executive leadership that are grounded in data. And so, if you can find out either from the medical plan or from other providers what the risk profile of your employee set looks like, well, then you can make more educated decisions on how to invest your limited amount of time, resources, and other other efforts related to supporting and managing chronic disease. So oftentimes, we talk to companies about 20% of their employees are at risk for type 2 diabetes at any given time. And having done the employee risk test now and gotten some data from employer sets, that's pretty much bared out to be true. When we're able to survey team member employees at a company, anywhere between 18 and 28% is what we've seen in terms of the risk for prediabetes at a specific company, and that's regardless of size or industry. So when we have that knowledge base, well, then we can start to build a conversation around, well, if we do nothing at all, here's what the potential cost over time might be of individuals developing diabetes who are at risk of prediabetes or already have prediabetes. So doing nothing at all is certainly, an option, and that might cost X. But if we invest in the diabetes prevention program, which is an evidence-based program, as Sarah mentioned, well, then we know the cost of doing that, and we know that a certain number of people will be successful in completing that program. And so we can actually have a true return on investment or value on investment conversation when we're able to be grounded in data. So that's my recommendation for companies is always, what can we find out about the risk profile of the employees?
Great. So, you talk a lot about engaging employers and how to get them to care about chronic diseases. Do you have any data from the employers that you did this study with about, participation rates and implementation rates of diabetes prevention programs? Do you have any of that follow-up data?
Yeah, thanks for that question. So that sort of data was not within the scope of this specific study. And so we unfortunately don't have like specific participation data from these companies for the National Diabetes Prevention Program. That is actually something we had cited as a limitation in this and kind of like looking forward, what could we, what data could we collect to be able to report on that? But some of the organizations that we're working with now, we have some partnerships with like local health departments that are delivering the national DPP and employers. And although the data itself is aggregate due to HIPAA, we still have kind of more of that anecdotal data of like how many people, signed up, how many people made it through the halfway period, and then how many individuals ended up dropping out, and then some of the reasons for that. So yeah, I think that's a good opportunity for future research is to
Yeah.
really kind of get in the weeds with that.
Yeah, you have to remember too, Katie and everybody on the call, we've been hired by the state of Colorado through federal funding to be what they call a business influencer, to get businesses to care and participate in the diabetes prevention program or in other chronic disease prevention and management programs. We are not the provider. And we've recognized over the 9 years now that we've been doing this that having deeper relationships with providers is really important. And also, like Sarah now is working directly with providers on coaching them on how to collect data, on how to report on data. And in those moments and in those relationships, then we do start to get some data on our own, at least at the aggregate level of participation rates. As an organization that has deep connections and contacts in the business community, ultimately, success in the program is a reflection of HealthLinks and of the work we do. And so it's an important component. But for the first several years that we were doing this and before, before we had the break with COVID and all of the things that went on through that, we really sort of said our role was to get the companies to care and to sign up with a provider. And we did not put as much attention into that transition of now that the program is being implemented, and we assume with fidelity to the diabetes prevention program model, how much we also needed to continue to maintain the relationship with provider and with organization employer to make sure that there's longer term success than just a one-time go. And so I think a lot of our efforts now in this, post-COVID era are really on how do we sustain and maintain the program. It's an element we've added, like a training directly for providers on business engagement. And then Sarah doing a lot more work with the provider end of things to make sure that the program continues on an annual basis at each company.
I can certainly appreciate those of us in the public health space are used to data collection and, we put a lot of emphasis on data, but I can imagine that employers, it's less of a priority. So can definitely see that. If anyone has any questions, feel free to put them in the chat. One question I have is just related to, other chronic disease prevention and management programs that you might have seen yourselves or other across the country. You mentioned, obviously National Diabetes Prevention Program. There's DSMES, the Diabetes Self-Management Education and Support Programs. Are there other chronic disease management programs that you all are rolling out or that you have seen rolled out in other areas?
This is a good question. Sarah, I'm happy to take
Yeah, go
a
ahead.
first stab at this. I know, Katie, for a brief moment in time, we were working with you all on promoting the, is it called
Walk with Ease,
Walk with Ease
Arthritis
program?
Foundation Walk with Ease.
Right.
Yes.
Yeah, Walk with Ease. So there was limited interest in Walk with Ease. I think we need to do a little bit more research, and we've tried to get some companies to participate in that. There's in from my standpoint and as a researcher, there's limited scientific research and evidence behind some of the chronic disease prevention and management programs. We certainly promote a lot of tobacco cessation programs, which is tangential, but also still connected to some of this work in supporting people in recovery from substance use disorders as another chronic medical condition. We often talk about a variety of different treatment modalities. One that we've done a fair amount of work on is what does the cancer supportive workplace look like? But again, there's different treatment modalities, whether it be oral chemo or traditional chemotherapy or a variety of other modalities. So when we talk about a chronic disease prevention and management program, there's not a lot that come top of mind that have the type of
Yeah.
research and science behind them as diabetes does. And so that's the one we've sort of landed the most on. Again, connected to it would be tobacco cessation, lactation accommodation, breastfeeding support,
Hmm.
our cancer supportive workplaces. We tried with hypertension and Walk with Ease were the two that we tried to promote. We've yet to get too many companies to pick them up. Sarah, I don't know if you have any other ideas on that.
Yeah. I mean, I wouldn't say this is necessarily like an evidence-based program, but we are doing a lot of like healthy eating and active living work. And so again, I think there is opportunity for some more research behind that. Maybe I've seen, evidence-based like weight loss programs and nutrition programs. But again, nothing really as compared to national DPP or even DSMES. Another one that I have seen is Alzheimer's mitig or management. But that's something that we at HealthLinks have not yet really been able to tap into is like supporting the aging workforce.
That's great. Thank you. It definitely helps, to make the case to an employer to help with that business case model to have some data from other employers to demonstrate the benefits of getting those programs in there. So certainly understand that.
That is one thing, Katie, I want to mention that it is not necessarily part of the presentation, but for those of you on the call, the more you can build case studies of companies you are working with that have had success with with any program you're offering, I think those case studies are really relevant and important to share with other businesses, right? And so it's one thing for the public health professional to tell a company this is important. It's another thing for them to hear it from another business partner or someone they respect, someone who's in the same industry. So we've really tried to create as many B2B conversations as possible, business to business, so that it's not just the public health professional or the HR team that's sharing the story. It actually comes from other colleagues in their industry that they respect and follow and listen to.
That's a good point. And we'll end there. Thank you again, Sarah and David, for your presentation today. And thank you to everyone who attended. I'm going to